Hello, this is for EMC461-51 Simulation Laboratory with Professor Mandeville. My name is Mark Smith. I'll be the first presenter. The second presenter will be Bradley Miller, and the third presenter will be Alexis Gibson. So today we're presenting on Lauder versus Teaneck Volunteer Ambulance Corporation. The New Jersey Superior Court Appellate Division case law course, basically talking about an incident that happened with Mr. Leroy Lauder, who is the plaintiff, and three defendants. You have Furna Washington, who is the manufacturer of the gurney that Mr. Lauder was transported on. You also have the Teaneck Volunteer Ambulance Corporation. They're a volunteer ambulance service that responded and transported the plaintiff. Also, third defendant, Holy Name Hospital. This is where the patient was transported to, and also where the paramedic that responded with Teaneck Volunteer Ambulance Corporation had been employed. It was found that the plaintiff, Mr. Lauder, had died as a result of his injuries that he sustained after the stretcher had fallen when the wheel mechanism collapsed. During transport, the paramedic had released a chest strap to set the plaintiff up in an upright position, and this caused the plaintiff to fall and strike his head on the ground during the collapse of the stretcher. Now, the way it's presented in this case is that paramedics started to initiate the treatment in the ambulance. They get to the hospital, they're bringing him out, but due to the fact that he undid the chest strap, caused him to lean over and strike his head. Now, an interesting point to think about in this case is that there was a summary judgment that was issued to the ambulance squad under a New Jersey statute annotated 2A53A-13. It provides immunity for volunteer first aid or rescue squads. It's a little difficult to understand if the paramedic was actively working for the hospital. I can only assume, which isn't really a good thing, that he was. Or was he an employee but off of the clock and responding as a volunteer? Another point in this argument as to whether or not the paramedic was actually providing ALS while removing the patient from the ambulance. As it was noted in there that he removed the chest strap to sit the patient up, and that was considered ALS along with giving oxygen and attempting an IV, yet having visual observation on this patient by an ALS provider is not considered ALS.
According to the Lauder versus Teaneck Volunteer Ambulance Corps trial conducted by the Superior Court of New Jersey Appellate Division, there is no specific timeline when it comes to this case. So the reason for this is most likely because this case was not really an issue with the timing of treatment given to this patient, nor was it an issue with the actual treatment rendered to this patient, but is more so an issue with securing the patient on the stretcher and making sure that he had the appropriate safety devices on his person. Because of this, like I said, there seems to be no appropriate or no specific timeline according to this patient. So I'm going to go over what I believe, according to the trial, is the order of events that the patient went through, or the paramedic went through with the patient. So he arrives on scene. It seems like, according to the trial, he assesses the patient. He determines that the patient's chief complaint is breathing difficulties. Now, after this, it seems like, according to the trial, the paramedic does, in fact, load the patient onto the stretcher. The first time he uses all the appropriate straps, everything is good, according to him. According to the trial, they load this patient up onto the ambulance. They then sit the patient, or the paramedic then determines he needs to sit the patient straight up in order to help him with his breathing. According to the trial, the paramedic, in order to do this, had to unstrap the patient, unstrap the chest straps from the patient. after this, it states that the paramedic then administers oxygen to the patient to aid with his breathing, since his original complaint was breathing issues. Then goes in to say that the paramedic did attempt to start an IV on this patient. After this, it said, or the trial stated, that the paramedic did not render any more treatment to this patient. Now, it also states that the paramedic said that he did not restrap the patient after this. So then the patient is transported to the hospital. He is, because he is not fastened back with the appropriate straps onto the stretcher, there seems to be some complications when unloading the patient from the ambulance. So what happens is they unload the patient from the ambulance, the stretcher either malfunctions or there's a handling malfunction causing the stretcher to tip, and the patient, due to the fact that he is not strapped in, seems to fall off the stretcher, striking his head, and therefore subsequently 3 days later passes away. Now, after he strikes his head, there's no mention of any treatment rendered after this. There's nothing rendered about, or nothing talked about in terms of C-spine or anything like that. But that is what the trial states happened. There's no times, nothing like that. So that is what I got from this trial.
What can be learned from the case of Lauderdale versus the Teaneck Volunteer Ambulance Corps? This case evaluates a situation where a patient received a fatal injury due to an accident that occurred during patient care. For whatever reason, the stretcher utilized for patient care in this case did not function correctly and resulted in the patient's injury and ultimately death. Though this incident may have been prevented, all accounts determined that it was indeed an accident. There was no evidence suggesting that the paramedic or members of the ambulance squad acted negligently or with any malicious intent. Rather, they acted with the patient's best interests in mind by releasing the chest strap so that he could maintain a position of comfort and optimal breathing. The paramedic and ambulance squad members handled themselves well in this case. They acted in the best interests of the patient and portrayed both confidence and professionalism in the succeeding trial. Although there were no indications of negligence, we must still acknowledge that a life was lost due to an error in patient care. This case reminds us that we should always be thorough and efficient in the movement and transport of our patients. In order to do this, EMS providers should consider the following actions. Providers should make an effort to practice with the equipment used at their services and make sure that they are able to operate it safely. There was no way to prove in this case that poor operation was the cause of the accident, but this could definitely be the case in future events. Providers should also invest in their physical strength and well-being. Bryce et al. Shows that studies have found that factors such as inadequate sleep or physical fitness in EMS employees can jeopardize the safety of both themselves and their patients. A study performed by Prairie et al. Also suggests providers should use careful and coordinated movements whenever lifting or moving a patient. They should also make sure that they are communicating with everyone who is involved. This ensures the safety of the providers and the patient by preventing injury and ensuring that movements are swift and deliberate. Providers should also maintain a knowledge of the traffic and safety laws for ambulance transport. A study performed by Whitting et al. Found that the average knowledge of EMTs of traffic laws is alarmingly low and is a large contributor to safety violations in EMS. Finally, we should always ensure that our actions are in the best interest of the patient and are never negligent or malicious. We should always strive to maintain a knowledge of appropriate safety measures and to care for our own health so that we can perform to the best of our ability. Each of these measures will allow us to give the most effective care to our patients and ensure that both provider and patient avoid harm.